Am I on? Okay. So Ching is a hard act to follow there. But thank you. We are excited to see you all, and we're excited about all of the interest and enthusiasm around investing in healthcare IT. So a lot of people have asked me what really spurred my interest in investing in healthcare IT. And what I tell them is when I started at Morgenthaler, the partners there really encouraged me to go after big problems with big markets. And I didn't see anything bigger than healthcare IT. And they encouraged me not to go after incremental solutions. And I don't think there's anything incremental about fixing the healthcare problem in the country today. Now, according to Henry Aaron of the Brookings Institute, I love this quote. At the end of the day, the only reasonable conclusion is that we waste a huge amount of money on the most nuttily cumbersome administrative system in the world. And he's not talking about the federal government, he's just talking about healthcare in general. And so there's a lot of opportunity here to make things better. Now, a lot of people in this room are well aware of how much we spend on healthcare every year, but we do have a really wide and diverse audience today. So I wanted to spend just a couple of minutes and level set everyone in terms of the magnitude of the problem here. So we spend in the US 17% of our GDP every year on healthcare IT. And this is growing faster than the rate of inflation and is 5 points higher than the next country. And on a per capita basis, we spend twice what most developed countries do every year on healthcare, twice that of Germany and France, and about $7,500 per person per year. Now, you ask yourselves, when did this happen? Have we always been spending this much more than the rest of the world? And the answer is no. In the 1980s, we were pretty much at parity with the rest of the world. And in the last 30 years, it's steadily increased, and the gulf has widened year over year. And this has made the increased urgency for innovation at an all-time high. Now, just for some background, you ask yourself, okay, we're spending a lot of money, but where is that money really being spent? Well, half of the money is spent on hospital services, physicians, and providers, and clinical services. And in addition to that, a couple key factoids to kind of keep in the back of your head. In 2009, during the recession, the health insurance companies actually increased profits about 56%. And pharma is consistently one of the most profitable industries in the United States. Now, on a patient level, what we also need to keep in mind is that 5% of the patients actually you can attribute half the cost of healthcare to, and 75% of the spend is on chronic illnesses, for which obesity is a big component. Now, I wanted to take a few minutes just to bring this back down to earth and make it a little bit more relevant for everyone here in the room. So I was recently back visiting my family, and I have a cousin who's a vet. And he just said at dinner, he's like, I don't get it. He's like, how can I pay $3.50 for a bag of solution in my vet practice? And he just recently got a hospital bill for a stay, and that same bag of solution with the same manufacturer was $150. And it doesn't make any sense, right? And a couple more examples. I have a friend who was hospitalized recently, and he got the hospital bill back, and he was charged $38 for an Advil. And, cost at the pharmacy is about 9 cents. And I was just kind of bewildered by this. And then I was using Simply a couple weeks ago to just kind of take a look at the product. It was a really cool product, by the way, and see what my own healthcare expenditures really look like. And on that bill, I saw charges anywhere from $292 to $616 to take my 2 little kids for well baby and well kid visits, right? So this is, $600 to find out that my kids are in the 99th percentile of height and weight, and they might well be rugby players when they get older. And would I do that if I didn't have health care insurance? Well, probably not. So now with so much money being poured into healthcare every year, you'd think we'd have better results. But unfortunately, right now, the answer is no. Most of you have seen these numbers. So we're 41st in the world in infant mortality and 46th in the world in terms of life expectancy, well behind Cuba and Chile. And a big problem is the uninsured, right? So 17% of people don't have health insurance right now, and this has a big economic and social ramifications. So with that number, 45,000 deaths approximately every year are caused due to lack of health care insurance, and medical debt contributed to 46% of bankruptcies in 2007. And even some would argue that the health care is killing us, and there was 195,000 preventable hospital deaths or preventable deaths due to medical errors. Now, I would argue that there's huge opportunities here for change and for improvement, and there's nowhere better to spend your time and your focus and your commitment to make a company and to make real improvements. And with these costs spiraling out of control and growing faster than the rate of inflation, the problem right now is the discussion is really centering on how to pay and who will pay. And to me, this is just the wrong question. It's akin to opening all the doors and your windows of your house in the middle of winter and then wondering how to pay the bill to heat it. It's the wrong question. The right question is how to reduce cost and how to improve outcomes. And the entrepreneurs can fix healthcare by creating companies that address these two issues, how to reduce cost and how to improve outcomes. And they can do this by applying information technology and by creating new business models and products and solutions targeted towards the end consumer. And one shining example of this is Practice Fusion. And Ryan Howard, the CEO, will be with you a little bit later today to speak to you. And we invested in Practice Fusion because we believe that the first step in fixing healthcare was to have access to the data. And to do this, you need an EMR. You need a core place where that data really resides. And you need to have access to it in the cloud so that you can analyze all this data in close to real time. In addition to that, you really need a compelling business model for widespread distribution. And there's no more compelling business model than free. And so Practice Fusion is a free cloud-based EMR. They currently have 20 million patients in their database, which, for perspective, is more than Kaiser and the VA combined. And they are currently racking on about 1 million new patients every 8 days. As a result of the success of Practice Fusion and just all the changes and things taking place in the legislature in Washington, a year ago, we decided to hold the first DC to VC event. And similar to this event, the reason why we did it was to stimulate interest in healthcare IT investing by bringing together entrepreneurs, venture capitalists, and policymakers in one forum where we can talk about the real issues facing healthcare IT and the real opportunities ahead of us. This year, we've partnered with an amazing group of people to pull together a nationwide search for ideas. So we partnered with universities from coast to coast, investors, and incubators, and this has resulted in over 117 submissions for ideas and plans in both seed and Series A. And from this, 11 will be presenting to you today. Now, during the process of selecting these companies, I was really humbled by the passion of the entrepreneurs. Many of these entrepreneurs that we'll be talking to you today have been impacted by the healthcare system and have really started their companies based upon that experience and wanting just to make positive change in what they've seen. Now, we didn't filter for geography at all, but at the end of the day, we put this map together, and I was really pleasantly surprised to see that these entrepreneurs come from across the country. And in fact, only 4 are from the Bay Area. So a lot of people that you'll hear from today have traveled a very long way to get here. And these entrepreneurs will fix healthcare by attacking the really big problems in front of us. First of all, they'll use information technologies. Now, this may seem obvious to everyone in the room, right? But it never ceases to amaze me that after having spent years in financial services, healthcare IT is about 15 years behind. You know, today I can go online, I can check my bank account, I can do transactions, and I can get advice even on where to spend money and what kinds of products and services to buy. but I can't download my kid's immunization record. And I tried to get it last time I was at the primary care physician for them, and in fact, I had to have it emailed, and I showed the doc on my iPhone, but they couldn't get it. Even though they had an EMR, they still couldn't get it in their record. In addition, just to make it a little bit more relevant, a little more global, so back in the year 2000, I was visiting New Zealand, and I was in a town of 300 people and had to go see a doctor. And in that town, I basically all my information was plugged into an EMR. And now, currently, I go to a doctor in San Francisco, California, and I still don't have an EMR system that my information is in. So in terms of other ways that entrepreneurs are going to help us solve these big problems, their companies will improve quality, efficiency, and convenience. And they'll do this in a couple of ways. One set of entrepreneurs that you'll hear tonight is really working on business information systems so that we can actually assess what works and what doesn't work, right? There's 3 different kinds or options for knee surgery. But when you talk to different docs, they have different opinions based upon which one works better. And it's largely subjective. There's not really data behind it. And I think to really improve the cost and the outcomes, we need access to this data. The other thing they will do is they'll help bring these solutions closer to the end consumer. So examples of these companies that you'll see tonight are companies tackling the hard problem of telemedicine, telepsychiatry, and also just remote diagnostics. So actually bringing diagnostics into the hands of patients. And when you think about it, this trend has been happening kind of slowly through years. Everything from in-home pregnancy testing, which you had to, before you had to go into the doctor to actually access, to diabetics regulating their own insulin supplies. So it's already something that's been in the works, and I think this will continue to happen as we move forward. These companies will actually also help us over time have a more rational system. So by adjusting provider compensation, aligning incentives, and actually creating a marketplace for services. So simply, people simply do what they're incentivized to do. And right now, there are 9,000 codes for procedures and services that doctors use and providers use for billing, but there's not a single code to incentivize wellness or compliance. And this process of compensation has to shift. And in addition to that, providers are paid the same no matter what their true cost. So no matter what an operation or procedure costs them, they're actually paid the same. And this isn't a rational marketplace. So over time, entrepreneurs will help to form companies that move away from this fee-for-service model into a realm where people and patients, providers, and payers are all rewarded on an actual outcome basis. And most importantly, the companies will help us to encourage prevention and wellness. Now, consumers may not, and perhaps may never, do things in their best interest of their health. But what they will do, and what they've been shown to do, is act in their own financial interest and react to social rewards. And so companies, we're already seeing a number of companies leverage these key aspects to help improve health overall. And ultimately, the end consumer has to be involved in the purchasing decision. And right now, the consumer is the person who's kind of left out of the loop. You know, when you think about it, when was the last time you made a decision about a doctor or a procedure based upon the cost up front? So until the consumer is really in charge of that purchase decision and makes that decision based upon cost, quality, and convenience and results, I don't think that real healthcare reform can happen, but I'm optimistic that that day is sooner than we might think. And all of these companies will leverage government regulation. So the government can't create change, but it can help incentivize change. And it's done that with both the HITECH Act and the Affordable Care Act. So with the HITECH Act, $19 billion was set aside to encourage adoption of electronic medical records. And with the Affordable Care Act, they're moving the incentive really away from fee-for-service into outcome-based payment. We feel now is the time for entrepreneurs to fix healthcare. Never has the ecosystem been so ready or the pain point really been so high. And technology with mobile, social, and cloud infrastructures, I have every confidence can be applied to healthcare IT in much the same way it was in financial services. There is political will to act. Healthcare reform is happening, whether you like it or not, but there are key areas that can be leveraged if you're an entrepreneur to help change. And there's opportunity for innovation. There is low-hanging fruit everywhere in this space. And business model for healthcare have not evolved in decades. There's a ton of opportunity to make a positive impact. And most importantly, smart and talented entrepreneurs are tackling this issue. They come from a wide variety of industries. They don't just come from healthcare, as you'll hear tonight. And they're bringing their own industry knowledge and expertise, as well as their own personal experiences with the healthcare system with them. And we've seen investors have agreed with us that now is the time to invest in healthcare IT. Healthcare IT investing was up 27% in terms of dollars and 58% in terms of deals from Q2 of 2010 to Q2 of 2011. And we're very, very delighted by that change in pace. So we look forward to seeing the entrepreneurs and companies today, and we look forward to seeing them tackle the big problems in healthcare that we all face, and hopefully that will lead to reduced cost and improve outcomes for all of us. And with that, I would like to introduce Matthew Holt, who would like to be known as Your Highness, I believe.
Are you sure?
Yeah.